Hello, my name is Dr. Lisa Campo. I am a nurse practitioner from Student Health Services here at George Mason University. I have worked here at Mason for a little over 10 years, both teaching in the graduate nursing program as well as working in student health providing health care to our Mason students. I've been a nurse practitioner for over 20 years now, and preventative health care and helping patients stay healthy is very important to me. For the next few minutes, I will be narrating the next part of your presentation and discussing preventive health care. My hope is by the end of this presentation, you will understand what is meant by preventive health care and why it should be important to you. What is preventative health care? Preventive health care is focused on helping you to stay healthy and prevent disease. The goal of preventive health care is to identify potential risks for developing an illness or to identify an illness early in order to avoid complications or worsening of that illness. A disease like diabetes, for instance, if identified early, may be controlled before it does damage to your body. Another example would be cancer. If cancer is identified early, it's much easier to treat before it has spread to any other area of the body. So why should preventive health care matter to you? We all have risk factors for developing diseases. Your personal risk factors for developing a disease are very different from the person that's sitting next to you. These risk factors can make you more likely to develop an illness or disease. For example, smoking cigarettes makes you much more likely to develop lung cancer. Another example would be that women are more likely to develop breast cancer than men. So when thinking about your personal risk factors for illnesses, you need to know that there are some risk factors that we can change, like our health habits. Do you smoke? Do you exercise? Are you overweight? And there are some risk factors which we cannot change, like are we male or female? How old are we? And what is our genetic background? Many people will say, maybe you are saying it now, I'm too young to begin to worry about all these things. I know what my risks are. I don't smoke. But the earlier that you develop good health habits, the less likely you are that you will develop any kind of preventable disease. Healthcare providers can help you evaluate your own personal risk factors and develop a plan to reduce those risk factors. You may not be aware of some of your own personal risk factors. They will take a health history from you as well as your family history. They can also help do a physical exam in order to help focus on ways to stay healthy or improve your health. You may right now have an elevated cholesterol, elevated blood sugar, or elevated blood pressure and really not realize it. According to the Centers for Disease Control, chronic diseases such as heart disease, cancer, and diabetes are responsible for 7 of every 10 deaths each year in the United States. These chronic diseases are largely preventable or can be discovered through appropriate health exams early when their treatment for them could work best. If not found and treated early, these diseases will cause long-term problems with your health and early death. Cancers not found early may already be advanced and may be much more difficult to treat and more likely to cause death. Many of you may have family members who've died at a young age from a stroke or a heart attack. This could be due to health habits, but it also could be due to genetics. So if this is true for you, it's important for you to have regular physicals and screenings for these diseases to try to prevent you from developing these issues. The 5 leading causes of death in the U.S. are heart disease, cancer, chronic lower respiratory diseases, which would be things like emphysema or chronic bronchitis, and many times this is caused by smoking. Number 4 is stroke, and number 5 is unintentional injuries, usually caused by an accident. The right preventative care at every stage of your life helps you to stay healthy and can avoid or delay the onset of disease. It also can help keep diseases that you may already have from becoming worse. The majority of healthcare plans will pay for routine preventative healthcare screening and annual physicals, as well as cancer screenings, which would be appropriate for your age and also appropriate for you because of your family history. For example, if your father died from colon cancer at age 40, it would be advised that you begin having colon cancer screenings and exams done, such as a colonoscopy, done at the age of 30, which is much earlier than the average person would. This is something that would be discussed and evaluated with your primary care provider during an annual exam. Examples of preventive healthcare services are things like cancer screenings, annual physicals, vaccinations to keep you healthy, and birth control counseling. So now, what I'd like you to do is think about questions you would like to ask a healthcare provider about your health. Remember that healthcare providers can help you to identify your risks for illness and how to decrease those risks and stay healthy. You should discuss your family history and your own personal health habits with your provider so that they can help you come up with a plan. Providers in student health services here at Mason can provide free smoking cessation counseling, weight reduction counseling, birth control counseling, and even arrange for nutritional counseling for you. Please consider making an appointment. Thank you.